Okay, this video is part 2 of food and mood. There's going to be 3 parts. So continuing on, if you type into your computer browser, what is the global distribution of depression, for example, you'll see that it pretty much matches the standard American diet, the westernized diet, which is a very high-fat diet. Also has a lot of simple sugars. And of course, it elevates C-reactive protein in the blood. That's like an acute phase reactant released by the liver in the setting of inflammation or infection. But it's also elevated when you eat a high-fat meal, and that's thought to be a myokine effect from the muscle signaling that it's not able to replenish its glycogen. That's Gregory Sloop, MD. He's like the best atherosclerosis researcher. A high-fat, high-simple sugar diet has been shown to decrease BDNF, brain-derived neurotropic growth factor. So decreases the ability of neurons to form new connections. That's how you learn stuff, is by making a new connection. You take the new information and you connect it to the old information. You have to associate it with something. All learning is associative. And so it basically impairs your brain's ability to learn anything. High-fat, high-simple sugar diet is not what the brain wants. Especially it's the high-fat. That's a real big deal. That's why I'm not a fan of all these, I need my extra fats. No. All right, meat causes inflammation for multiple reasons. First of all, meat has a lot of saturated fat, which contributes to causing leaky gut. It's often fried. The vegetable oils contribute to leaky gut. With the leaky gut, you get gram-negative bacteria that are partially digested by the digestive enzymes, then releasing their lipopolysaccharide or endotoxin, and that's getting across the gut barrier. So they'll get postprandial, means after eating, endotoxemia, elevated LPS in the blood. So eating meat causes endotoxemia. That's bad. It also, the saturated fat, causes a partial increased permeability or leakiness of the blood-brain barrier. That's bad. The brain cells have to maintain a precise neuronal milieu. So anything that increases blood-brain barrier permeability in an unexpected or unwanted way is going to decrease the ability of neurons to function. There's also something called xenosialitis from beef due to abnormal sialic acid getting into the glycocalyx. I had a separate lecture on that about problems with meat. And so the bottom line, it's all bad. You don't need to eat meat at all. I recommend 0, not 1 bite. Obesity is associated with increased systemic inflammation. Yeah, fine. The reason we're going to go into this inflammation stuff is because the hot new theory on depression is that it's caused by inflammation. Okay, does the brain function better when it has good blood flow or poor? Of course, good blood flow. Okay, what causes poor blood flow? We talked a little bit about this before. We'll go through a quick. Blood sludge, rouleau formation, primarily from eating a high-fat diet. Vasoconstriction from eating omega-6. Vasoconstriction from eating sodium. Omega-6 cooking oils, they'll cause problems like lipid peroxidation. Omega-3 oils can also cause lipid peroxidation problems. That's why I'm not a fan of supplementing with them. The type that comes in plant foods have fewer double bonds, so they're less likely to run into problems with lipid peroxidation than the fully extended, DHA, for example. Chronic cerebral hypoperfusion, yeah. Chronic cerebral hypoxia from things like tobacco, high-fat diet, sleep apnea. All those things are impairing brain function and are going to potentially lead to mood problems. Interesting thing is food allergies can be a source of causing anxiety and fatigue. So one can do an elimination diet, and these are some of the most common things: dairy, corn, wheat, and there's other things. You can look that up, but just consider that. If that's an issue you're trying to help for yourself or someone else, anxiety or unexpected fatigue, it might be one of these things. What are potential causes of anxiety? Overstimulation of the brain by life events, like post-traumatic stress disorder, but excessive stress or stress equivalents. Caffeine leading to insomnia, just the caffeine itself, corticosteroid medications. All of these things will increase unnecessarily the activity in your hippocampus and in some other neurons. Things that will increase the glutamate in the neurons, MSG, MFG, aspartame, mercury, they're all bad. A low-protein diet has a benefit of not saturating the blood-brain barrier transporters for amino acids, and it allows more tryptophan to get into the brain. Tryptophan is the amino acid precursor for making serotonin. Okay, this is just something from a previous lecture on, a theory of dementia. And the reason it's relevant is it's about the same things that eventually lead to dementia, lead in the short term to these mood disorders. Okay, you need good oxygen and glucose delivery to your brain cells. You get your antioxidants from eating your plant cells. Those protect you from all these things that damage your neurons. Stimulants are going to ramp up your metabolic activity, and that's going to make it harder for the neuron to match its blood and oxygen delivery. And chronic inability to get adequate oxygen and glucose delivery and to produce adequate amounts of energy can lead those brain cells to die through programmed cell death, apoptosis. You don't want that. And of course, there's a lot of toxins, things that just damage neurons, and you want to avoid those as much as you can. Okay, so here's sort of the big topic, inflammatory cytokine theory of depression. And by the way, I do think there's some relevance to this. I see depression primarily. I'm not a psychiatrist, but I do happen to know a lot about it. Perhaps not as much as a psychiatrist, but my father was a psychiatrist, and I know more about it than one would expect, okay? Like a lot of things, I've read about this in some tremendous detail. I've had personal family and friends who I've tried to help through this problem. MDD is abbreviation for major depressive disorder. They've shown now that there's elevated blood tests for interleukin-6 and C-reactive protein suggestive of inflammation. But like we talked about, just a high-fat meal will bump up your CRP. Also, the side effects of meat causing inflammation can bump up your IL-6. So these could just be side effects of a meat diet rather than some other form of inflammation. And so rather than treating this with a medication, why don't you try removing the meat from your diet, removing the vegetable oils from your diet, removing the processed food from your diet, and potentially control all of this without having to get a psychiatric diagnosis and take a pill. MDD is also associated with this marker of DNA damage from oxidative stress. It's called 8-oxo-2-deoxyguanosine. It'll be detectable in the blood and the urine of humans in association with depression more often. Elevated inflammatory markers in the blood, like these tests we just mentioned above, they're also associated with increased risk of bipolar disorder, PTSD, obsessive-compulsive disorder, schizophrenia, and Alzheimer's disease. So these are all bad for neurons. So that's kind of an important point. Like, what could you get out of this talk, amongst other things, is that there's a tendency in conventional medicine to say, oh, it's just genetic, nobody knows why it happens, take this pill, okay? Versus what I'm trying to say here is, if you understand that all this stuff, these meats, these processed foods, their preservatives, the herbicides, they're all damaging your brain cells and they lead to these brain disorders, you can try to fix all the diet and then also do lifestyle things like exercise, get sunshine, get your sleep, maintain some social relationships that are positive. All those things improve your brain function to counteract the negatives. That's what you want to get out of it, that you're not just some genetic victim of aging, that these things happen largely for explainable reasons, most of which are controllable or avoidable. So there's a way you can win the game. You have to do a little bit of learning and studying, but it's doable. Okay. Like we said, the LPS is the bacterial endotoxin from gram-negative bacteria, lipopolysaccharide. And that's detectable as soon as 2 hours after eating a meal with meat, and because you're kind of double screwed with the meat. The saturated fats increasing blood-brain barrier permeability, and now the gram-negative bacteria growing on the meat are going to get killed by the pancreatic enzymes, and then they're going to release their endotoxin, and then because the saturated fats increase gut permeability, it's going to break across the gut barrier and elicit an immune reaction in the gut wall and potentially one in the blood as well. And then the sat fat's going to increase blood-brain barrier permeability a little bit, and that's going to potentially cause central nervous system effects like brain fog. Okay, and in a chronic basis, damage to brain neurons. Inflammatory diseases are associated with increased risks of depression. So are metabolic diseases. Is diabetes inflammatory metabolic? I like to call it a dietary disease. The reason I like to call diabetes a dietary disease, especially type 2 diabetes, is then you can figure out what to do. Minimize dietary fat, minimize dietary sodium. Type 1 is also probably indirectly a dietary disease due to an allergic reaction, most likely related to dairy, potentially other things as well. And you know that a person who eats junk food and processed food, they're not depressed all the time. So it's not like this always causes. And also, like I said too, there's usually a inciting event that especially made the person sad, and then they're perhaps more vulnerable to it because of this dietary mistakes and weaknesses, if you will. The inflammatory cytokine theory is also explained it as thought by what is called sickness behavior. So it's when a person is sick sometimes with an infection, they'll like to be by themselves, not eat for a while, and just try to let the body heal itself. And what is thought to potentially be some of the reasons for this from a so-called evolutionary perspective. Number one, infection used to be super common, most common cause of death. By eating less, one reduces their blood iron, and also the liver will release hepcidin protein, which will prevent the macrophages in the spleen, for example, from releasing iron into the blood, stop absorbing iron from the gut, because what you're trying to do is sequester iron, keep it away from the infecting bacteria or virus, because they need iron to grow. The person will sleep more, they'll isolate themselves from other people, maybe to prevent other people from getting the infection. That's called the I am hypothesis. Isolation and sort of hiding out, if you will, till their body heals is something that might also protect them from predators when they're in this weakened phase. Having a fever also helps the body to fight infections. Characteristic thing in a sick person is they're less interested in their physical appearance or grooming. They're not thinking about looking good. They're thinking about just surviving their infection. Okay, here's a diagram of the blood-brain barrier. So for the blood-brain barrier, this is a glucose, outside the brain in the blood. Here are the endothelial cells, the main component of the blood-brain barrier. There's also parasites on there. The glucose type 1 transporters, they're not insulin dependent. They let the glucose come right into the brain area. The brain wants that glucose big time. The astrocytes, which are a glial cell, supporting cell. Glial means like glue in Latin. Astro is a star, cyte is cell, so they're star-shaped cells. They've also got glucose type 1 transporters to take up glucose, okay? But the big thing we care about, well, first of all, neurons have glucose type 3 transporters. Those are also not insulin dependent. GLUT1 and GLUT3 are not insulin dependent. But what really matters is GLUT4s. GLUT4s are insulin dependent, and the significance of that is brain cells do depend on insulin sensitivity. If you don't have good insulin sensitivity, you're depriving your hippocampal neurons, some substantia nigra neurons, some cortical neurons of adequate blood glucose. And you see the danger here. You ramp up metabolic demand with stimulants, and then you're eating high-fat meals causing insulin resistance. You're decreasing the amount of energy that neuron could produce, because the insulin resistance is not going to be able to take up more glucose. It wants glucose coming through those GLUT4s, and it's not going to be able to get it. So that neuron is screwed. It's starving in the midst of plenty. There might be tons of glucose in the blood, hyperglycemia, but because of the insulin resistance, these neurons in your memory center, hippocampus, and your substantia nigra, one of your motor centers, cannot take up enough glucose, putting them at risk for programmed cell death, with the situation made worse by simultaneously taking stimulants like MSG and caffeine, which are going to ramp up metabolic demand, and to make it even worse, ingesting things that are inhibitors of mitochondrial energy production, like the ones we listed just previously. Okay, a couple points about brain cell metabolism. The brain is, it wants oxygen more than anything. And despite its small weight, it's only 2% of body weight. It uses 20% of the oxygen in the body. So it's like a vacuum, vacuuming up the oxygen and glucose. Okay, so you want to give it what it wants. Your brain keeps you alive. Neurons use 65% of their energy to make ATP just for running that potassium sodium ATPase that we showed in their plasma membrane. It's like the whole energy battery for the entire cell. We talked about the glucose type 4 transporters, how those are impaired by insulin resistance, and then that the brain cells, they just can't burn fats well enough. The neurons, it doesn't help them. Okay. Okay, blood-brain barrier. We talked about the picture of the blood-brain barrier. The astrocytes are the supporting cells, the glial cells, kind of like the mama cells to help the neurons do whatever they got to do. They can actually store a little bit of glycogen, which you build up from exercise, for example, and also from studying a lot. Okay. Now I'm going to show you another picture here, and this will show you why brain cells can't burn glucose. If we look at a glucose molecule here, we know that when this is metabolized through glycolysis, and especially then through Krebs cycle, these carbons are going to get blown off as CO2. Okay, right now this is a carbohydrate. Carbo for carbon, hydrate because each one has about the equivalent of a water molecule on it. 1, 2 hydrogens and an O, H2O. So H2O, 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 H2O. Extra carbon here, consider it up here H2O. So the net effect is to have a water for every carbon. So glucose is already largely oxidized. By oxidized in this case, I'll just say having oxygens on the carbons. It's very ready to be converted into CO2. It's already more than halfway there. In comparison, look at this molecule of fat. This is palmitate, a saturated fat, meaning no double bonds. And notice there's no oxygens on any of these carbons except the one at the end. This is called the carboxyl carbon. Also, a double bond to an oxygen is called a carbonyl. So this is a carbonyl carbon. The carbon adjacent to it is the alpha carbon. The next one is the beta carbon, like the Greek letters of the alphabet, alpha and beta. And that'll be relevant later when we talk about beta oxidation of fats. But the important point here to realize is all these carbons have no oxygen on them. So in order to convert those into CO2, there's a long way to go. It's a long way to Tipperary, okay? And what that means is it's going to take an extra about 20% oxygen to metabolize the fat compared to the glucose, which you don't need as much oxygen. So your brain already a lot of times is not getting as much oxygen as it wishes it would, especially if the person's older, has a lot of atherosclerosis, they're eating a high-fat meal and a high-sodium meal. You're vasoconstricted with thick blood. And so if you want to throw on top of that, trying to metabolize something that requires 20% more oxygen, no way. It's not going to work for the neuron. Plus, the neuron's like a fast-twitch muscle fiber. It has to be on and off real fast, doing all kinds of incredible things. So what I'm saying is fat does not work for brain cell metabolism. It not only impairs oxygen delivery, it needs more oxygen to burn it. So your brain cells can't burn it. So you see how your brain cell is screwed in the context of insulin resistance and diabetes? You got all this fat in your blood, but your brain cells can't use it, and they're starving for glucose, but they can't get the glucose because of the insulin resistance, so they can't get energy. And it doesn't matter how much glucose and fat you've got in the blood, it can't get into the brain cell. Brain cell dies. Okay, so diabetes and hypertension leading to atherosclerosis, that's what kills people. That's what kills most people. And they're also major risk factors for cancer. So it's good to understand that, because people a lot of times are worried about all these rare diseases or specifically cancer, not realizing it's this diabetes, atherosclerosis, hypertension that are pushing towards it. So you want to control those things, and then you'll markedly reduce your risk. So here's just a little bit more about fatty acid structure. So here's the carbonyl or carboxyl carbon, and then alpha and beta carbons. And this is another palmitate, saturated fat, most common saturated fat in the human body, C16, 0 double bonds. And here's the hydrophilic end that's polar, meaning it has a charge on it. And here's the hydrophobic end, and the carbon and the hydrogens have similar electronegativity, so there's no significant charge here, so these are not polar. And the relevance is this amphiphilic nature, like an amphibian can live on land and water, enables a fatty acid to intercalate across plasma cell membranes and to be somewhat disruptive to plasma cell membranes. And that's why this palmitic acid, it can cause leaky gut when it's present in excessive amounts. It can cause increased permeability of the blood-brain barrier when it's commonly present in excessive amounts. So it's a problem. It's not good. The minimal amount of fat you get from eating low-fat plant foods is all the fat you need. Okay, here's just, saturated fat, no double bonds. A MUFA, like, the most common thing in olive oil, oleic acid, has one double bond. A PUFA, polyunsaturated fat, multiple double bonds, 2 or more. And I just show you that in between, so here's the double bond, this little sort of purple line, and that is the methylene bridge carbon, because it's called a methylene group to have a carbon with 2 hydrogens on it. And I show 1 hydrogen sticking above it, because that's the one that can get snatched away and cause lipid peroxidation. So lipid peroxidation just means that the methylene bridge carbon is snatched off, gets converted to a free radical, interacts with oxygen, gets made into a peroxyl. Peroxyl is when there's 2 oxygens together. That also is a peroxyl radical, and that can lead to a chain reaction that destroys membranes. So what am I trying to say? These PUFA fatty acids are a little bit dangerous. Okay, I talk about that in a separate lecture. I got separate lectures on fat metabolism, separate lectures on PUFAs and vegetable oils. So we won't go into it much more, but I'm just saying is, a lot of times people say, oh, eat all these omega-3s. Hold on a sec. Omega-3s are still potentially dangerous, okay? It's not like you need those things floating around in your blood in large amounts. Okay, we just talked about how the brain does not like to burn fat because fat in the blood decreases oxygen to liver. Beta oxidation of fat, because it's so heavily reduced, lack of oxygen, requires at least 15 to 20% more oxygen. That's bad. Cell doesn't want to do it. Okay, here's a good article if you want to read a Reiser's article on why brain metabolism does not favor burning fats. And why am I going through all this? Because the average person eats a high-fat diet. When I say I want a low-fat diet, I want like 10% or less fat. Okay, that's what you'll get from eating a low-fat plant-based diet typically. McDougall describes his diet as having about 7% fat. Okay, that would be like a perfect diet. All right, and so you especially don't want to be above 15%. I think real problems start to happen after that. So I just say these things because understanding, Pritikin said it, fat is bad. It causes problems, and all the fats are bad. Don't get me wrong. Some are a little worse than others, but they're all bad. This is what we were talking about a moment ago, starving in the midst of plenty, energy crisis because of insulin resistance with the glucose type 4 neurons on important neurons. Glucose type 4 glucose transporters on important neurons. Okay, we're almost done here, just a little bit more. SERCA inhibitors. SERCA stands for sarcoplasm, endoplasmic reticulum ATPase. You really call it a sarcoplasm in muscle cells. In other cells, it's called the endoplasmic reticulum. And the ATPase is for pumping. And no, that C I forgot to include it here. It should be for calcium ATPase. Okay, you have to be able to regulate your cytoplasm calcium. Otherwise, the cell's going to have too high a calcium. And in a neuron, that'll cause excitotoxicity. So some of these things related to food are food dyes. Some of these food dyes will inhibit SERCA in the brain. That's really bad. That's another reason. Processed foods are always bad. Just stay away from them. The only thing that's remotely a processed food that I would eat would be oatmeal. That's it. Everything else would just be the item itself. I'll just eat a blueberry. I'll just eat a banana, beans. They just come as the item. There's no label even. The best foods have no label on them. Okay, avoid those non-stick cookwares because you can get the POFA in them, which is kind of like F-, and there's problems with that. Avoid aluminum. That's another reason why you got to filter your water. They'll put it in the municipal water as a clarifier. Don't eat your food off aluminum. I won't eat out of aluminum container. And, like I said, I get teased by my family or friends that I'm fussy and all that stuff. I don't care. One of the things I think you benefit from learning from me is I work with the brain. I'm a brain doctor, okay? I care about the brain. The brain's fussier than the rest of the body. In general, what's good for the heart is good for everything else in the body, but the brain's fussier than the heart even. Esselstyn's diet will keep your arteries and your heart open. He's got the best results of any doctor in the world to prevent coronary heart disease. What I'm talking about is going another step above that. What can you do in addition to the Esselstyn diet to protect your brain? That includes eat organic only because you avoid some of the toxic chemicals like GP that are in non-organic food. You avoid the atrazine. You avoid a lot of things that I think are toxic. What else? You avoid the human waste sludge, okay? Sewage sludge. There's less cadmium in the sewage sludge from humans can have a lot of cadmium in it, which you don't want being used as a fertilizer on your food. Another reason why I like to eat organic. I want to avoid all this MSG stuff. It's a stimulant. Has a stimulant effect on your hippocampus, your memory center. I want to avoid all that. Other things that can be harmful to SERCA include, diabetes. Basically, the higher your hemoglobin A1C in the blood, which is a marker of diabetes control, the more likely you'll have toxicity to your SERCA. Marijuana increases, also impairs SERCA function in the brain and in the gonads. There's this big modern hype on trying to say MJ is good for people. In my experience and my studying about it, not good. A lot of messed up patients are messing around with MJ. And in my experience too, it's weird. MJ patients are kind of like patients who like soy. They think they're smart and they like brag about their MJ. And it's just sort of like they're all messed up. It's associated with all kinds of additional problems. Maybe I'll do a separate lecture in the future, but it's way overrated. Okay, cleaning chemicals for dry cleaning. They can also impair SERCA. I don't know why that got stuck on the slide. I forgot to take that off. Paints, adhesives, and glues and PCBs are associated with decreased SERCA function. Benzopyrene from cigarettes or from grilling milk. Benzopyrene from grilling meat can impair SERCA. So these are all things you want to watch out, because anything that's impairing SERCA is going to be messing up your neuron metabolism. Okay, here's just some references. I got references on all this stuff. And so the bottom line, same old thing I said before. You want to be like Adam and Eve, but with indoor plumbing and heating. We're not going to go into this hypertension stuff. So anyways, hope that was helpful. And I think I got maybe one more. I got 3 parts to this these lectures on food and mood.